$300,000. That's the trajectory of one diabetes warning sign most people over 60 never check. Your eyes, your neck, a cut on your arm. Weight you didn't try to lose. And urine your doctor never tested. 5 diabetes warning signs after 60. 5 price tags. 4 of them cost $0 to detect. But the 5th sign, the one most people treat with something from the pharmacy aisle, that one doesn't stop at year 1. Before the signs, there's a billing distinction inside Medicare that determines everything. Diabetes is a financial event before it's a diagnosis. The early signs of diabetes after 60 don't look like disease. They look like aging. Hidden diabetes symptoms go undetected because they mimic normal life. Medicare Part B covers diabetes screenings at zero cost twice a year if your doctor codes the visit as preventive. If coded diagnostic, your $283 deductible kicks in first. Then 20% coinsurance on top. Retirement financial planning rarely accounts for a condition you didn't know you had. And even after 65, Medicare doesn't cover what happens when 5 warning signs go unchecked for years, especially the 5th one. If any of these 5 signs puts you in a hospital, you pay $1,736 before Medicare pays anything. That's the Part A deductible per admission. Sign 1. One day, your vision is sharp. Next day, blurry. You clean your glasses. It clears up. Then 2 days later, it comes back. That's not your prescription failing. Those are diabetic eye problems. Tiny blood vessels in your retina are leaking and swelling shut. Diabetic retinopathy symptoms that most people blame on getting older. If this progresses to diabetic macular edema, one common treatment protocol is 9 injections per year directly into the eye. Each injection costs Medicare just under $1,500. The drug alone totals over $13,000 in year 1. Add the facility fees, the imaging, the specialist visits. That number crosses $21,000 a year. The detection test, a comprehensive, dilated eye exam. Medicare rate, $127. Your out-of-pocket cost, $25.45. $25 or $21,000. That gap is the cost of not checking. The next sign costs even more to ignore, and the detection test costs $0. Sign 2. A patch of dark skin on your neck or under your arms. It looks like dirt that won't wash off. That's called acanthosis, nigricans. One of the earliest visible diabetes skin signs. Your body is producing insulin, but your cells are refusing to use it. That patch is the signal. A peer-reviewed study tracking nearly 14,000 patients found that year 1 healthcare costs after a new diabetes diagnosis averaged $21,745. Those were 2018 figures. The number today is higher. The detection test, A1C, blood test. Medicare pays $9.71. Your cost, $0. Clinical lab tests under Medicare. Part B carry no coinsurance. a $10 test, or $21,745 in year one. The patch has been trying to tell you. The next sign costs nothing to test either, but when it turns into a hospital admission, the math changes completely. Sign 3. A small cut on your forearm. 2 weeks later, still not closed. The skin won't knit back together. High blood sugar breaks down collagen and slows blood flow to the wound. Your body can't repair what it used to fix in days. If that wound gets infected, the average hospital cost of a sepsis admission at a U.S. hospital is $23,200. That figure comes from AHRQ, the federal agency tracking every hospital admission in the country. That is 2019. Data. It's higher now. And your Part A deductible, $1,736, kicks in before Medicare covers anything. Detection test, a wound, culture, and gram stain. Medicare rate, $12.89. Your cost, $0. $13 against $23,000. But the next sign doesn't send you to the hospital once. It sends you to the emergency room. Sign 4. You dropped 10 pounds without trying. Clothes feel looser. Everyone says you look great. Your body is eating its own muscle for fuel. Glucose is flooding your blood, but can't get inside your cells. The weight loss that looks like good news, that's metabolic crisis. Unexplained weight loss at this level can trigger diabetic, ketoacidosis, a DKA emergency. Mean hospital charges for DKA admission, $30,836. Published in Diabetes Care. 220,000 admissions tracked. Medicare savings don't help if you never got the test. Senior financial planning never includes the cost of an emergency you didn't see coming. Detection, a basic metabolic panel. Medicare rate, $8.46. Your cost, $0. Highest single number so far. But the fifth sign makes all 4 of these look small. I didn't believe this next number when I first pulled it, so I checked it against 3 years of federal data. Sign 5. Foam in the toilet when you urinate, or waking up 2-3 times a night to go. You bought cranberry supplements? Cut back on water before bed. Foamy urine means protein is leaking through your kidneys. Diabetic, nephropathy. Your kidneys are breaking down because they've been processing glucose they were never designed to handle. Kidney health after 60 depends on catching this before stage 4. The annual Medicare cost for someone with chronic kidney disease and diabetes, $27,667 per year. That comes from the USRDS 2025 Annual Data Report. 1.2 million beneficiaries tracked, 27,000 lower than the last sign. And that's the trap. Your kidneys don't stop at stage 4. Stage 5 is kidney failure, and dialysis is one path forward. Dialysis has a trajectory. Year 1, $114,000. Year 2, $99,325. Year 3, $99,325. Cumulative $312,650. $300,000. 3 years. One ignored sign. That's the Medicare number. On private insurance, every single session runs 6 times higher. Medicare pays $240 for the same session. Retirement planning in 2026 means retirement budgeting for a cost that wasn't on anyone's radar a decade ago. The detection test, a urine albumin to creatinine ratio. Combined Medicare rate, $10.96. Your cost, $0, $10.96. Against $300,000. 5 tests, 5 signs. Total detection cost across all 5, $169. Medicare covers most of it at $0. Now, the one question that activates every one of those $0 screenings. You've seen 5 signs and 5 price tags. 4 of those 5 tests cost you nothing. The 5th, $25.45. Here's how you activate every one of those screenings in one doctor visit. Ask your doctor this. Given my age and family history, am I due for diabetes screening under Medicare's annual wellness benefit? And would you code the lab work as preventive screening using Z13.1 so it's fully covered? That one question opens the door. The billing code, Z13.1, is what makes the A1C and the urine test free. Without it, you pay 20% of everything after your deductible. Hidden diabetes symptoms don't appear on any retirement checklist. Healthcare in retirement is the line item that costs more retirees than any market crash. But this one conversation could be the most valuable line item in your retirement financial planning. If you know someone over 60 who's noticing dark patches on their neck, or vision that won't stay sharp, or a cut that won't close, send them this video. This one breakdown could change their next 20 years. You watched this far. That puts you ahead of most people who'll never run these numbers. The price of waiting is always higher than the cost of knowing. Comment one sign from this video you've noticed but dismissed. Your story might be the one that wakes someone else up. Subscribe because every symptom you ignore already has a dollar figure attached, and that number is never small. I'm from the Body Bill. Every body sign has a price tag. See you next week.